Good morning. I chose Huntington's disease, and it affects 3 to 7 per 100,000 people of European ancestry, and it is a mutation in the HTT gene that causes Huntington's. This gene provides instructions for making a protein called Huntingtin. This HTT mutation involves a DNA segment known as CAG, and normally that segment is repeated 10 to 35 times within the gene, and with Huntington's, that segment is repeated anywhere from 36 to 120 times. People that have 36 to 39 repeats of this CAG segment may not show any signs of Huntington's, but they carry the gene. Autosomal dominant pattern, which means that one copy of the altered gene in each cell is enough to cause the disease. And individuals with 27 to 35 CAG repeats do not develop the disease, but their children run the risk of developing Huntington's. Some signs and symptoms. Early signs and symptoms would be irritability, depression, small involuntary movements, poor coordination, trouble learning new information or making decisions. And then as it progresses, you'll see the patients with the involuntary jerking, twitching, trouble walking, talking, and trouble swallowing. Usually people that have been diagnosed with Huntington's live about 15 to 20 years after their signs and symptoms begin. If the juvenile form begins in childhood, individuals usually live 10 to 15 years. There's molecular genetic testing, biochemical genetic testing, and all of this is completely voluntary. You don't have to have the testing. Like if you knew your parents had the gene, you don't have to test and see if you have the gene. Research, there was a ton of different research that's being done for Huntington's. I looked at one about working memory training, and it was about 9 patients ages 26 to 62 that were in the early stages of Huntington's. They underwent 25 sessions, so 5 days a week for 5 weeks. And it was manipulation and storage of verbal and visuospatial information with difficulty adapted to their performance each time, and patients showed significant improvement. As for treatment for Huntington's, there's no real treatment to stop or reverse Huntington's, but some medications help to keep symptoms under control, and patients who exercise regularly tend to do a lot better than patients that do not.